It's been a while, and here once again, Charlie is hosting today's program, and I'm very excited about that. And so, Charlie, could I ask you to come up here and do an introduction of our special guest? Thank you.
Things have gotten so efficient. I still have a mouthful of food. Anyway, it's great to be back and to see everybody. Zoom's great until it gets old, and it gets old, and some of you probably know better than I do. Anyway, it's my pleasure, great pleasure, really, to introduce to you Scot McCray, the new Chief Executive Officer for Advanced Community Health. Steal his thunder, but Advance has been here, nearly half a century as a only federally qualified health center and community health center in Wake County. Got a long history, deep roots in this community and providing health care to the underserved in many neighborhoods, Southeast Raleigh particularly, but also in Cary, in the clinic here that Howard Manning is sponsored at Dorcas. Scott just joined Advance effective April the 10th. I left the board at the end of 2019, and a lot's happened since then, challenges with COVID, so he comes in at a very challenging time. He began his career in Camden, New Jersey, leading strategic initiatives that paved the way for Camden's economic, healthcare, and public safety reforms and national best practices. He's worked with FQHCs, integrated healthcare networks, and accountable care organizations. What I like about what I'm reading and hear more about is he also has a public health background, which is quite intriguing to me, involved with FQHC. Anyway, he earned a Bachelor of Science degree from Clemson University in public health and health science, completed the Master of Public Health with major in health systems policy administration from University of Medicine and Dentistry, New Jersey School of Public Health. His brief bio indicates he's a visionary. I would expect that, but he's a related market disruptor. That should be very interesting. So with that, and Kelly Wright is also, where's Kelly? Oh, there she is. Kelly is works with Advance as well in marketing. I met her briefly before I left the board, and she'll keep an eye on all of us. So Scott, the floor is yours.
Everyone, I have my notes here somewhere. Usually I don't use them. Thanks a lot for having me at the Cary Rotary. I'm new to North Carolina, literally. February 1st, I actually started physically at Advance. And I'm not new to the South, as Doc mentioned. I actually went to undergrad at Clemson, so I hope I'm getting tomatoes thrown at me today, being a Clemson undergrad. But at the end of the day, it's really good to be here. This is probably my most recent Rotary presentation. My first Rotary presentation was for the Camden Rotary back in New Jersey years ago, and it was at an old dark steakhouse. So the buffet salad was good, the crowd was okay, my presentation was in. The most recent one that I actually completed was actually in Stowe, Vermont. So that was a cold December night, really good food, really great ski lodge. I came outside to the middle of a snow squall. So right now, you guys are batting 1,000 for great weather and great atmosphere and a lot of good smiling faces. So we're gonna go ahead and get started. Bob, if you would. A little bit about my bio, just to back it up, is at the end of the day, I always say you can write whatever you want on your resume and your bio, but it's about your actions, right? It's about your actions and what you do every day to actually make this place better. And that has a lot to do about why the folks are in this room, the folks are actually on this Zoom call today, because you've all taken a pledge and actually committed your service and your time to actually be a part of this community that you live in and you want to serve your community. So the presentation today is going to be just a test drive and a little insight into Advanced Community Health, formerly Wake Health Services. Some of you have heard this presentation if you've been on the board for the past 5 or 6 years. My predecessor, Penny Washington, actually gave it to this body then. There's a few changes to it. We've actually changed our branding. I wanted to thank our Director of Marketing, Kelly Wright, for leading that charge. And I jokingly told her and Doc, if my presentation isn't great today, you can blame her. She writes all my material. So moving along. So every day, our purpose at Advance is to strive toward our purpose, to strive toward changing the lives of others. Our mission is to deliver quality, compassionate primary health care to every patient, every time in response to the needs of our communities. I think the most important phrase in there, and the words are in response to the needs of the communities. It's not what we believe, it's what our patients tell us, it's what our partners tell us, and we gather our resources and actually do the things that we have to do to actually meet people where they are. Our vision is to become a model of affordable healthcare and a trusted partner, building healthy communities one patient at a time. In this environment, we have really emphasized trust. With so many questions around the pandemic, with so many questions around healthcare costs, with so many questions around vaccines, people need a trusted partner to actually get the best information that they can. And for the bulk of the communities that we serve, that are communities that are impoverished, communities of color, right? There's so much hesitancy and there's so much distrust. So we have really forced ourselves to the forefront to have good, concise information about what's best for people in their families and in their communities. What is Advanced Community Health? Like I said, formerly Wake Health Services, now Advanced Community Health. Our branding has changed. We've upgraded our branding. But one of the things that has stayed the same is we have a new name, but we have the same mission: to serve, to meet people where they are. We have a new name still, but we have better service and better service delivery. Yes, we have a new name, but we've expanded our energy, our focus toward access, equity, and value. Equity and value are really, really important. Equity and value, to make sure that there's a standard way of delivering healthcare, that resources are equally deployed across this great county and across Franklin County as well, where we actually have practices. But at the end of the day, to ensure that the same high quality services that you would get at a UNC, that you would get at a Duke or Wake Med, we are offering that same caliber of services for those individuals that have some insurance, that have no insurance, that are undocumented, and even commercially insured folks as well. So community health centers, there are 42 community health centers in the state of North Carolina. I didn't realize until I actually set up shop in Raleigh how big this state is. This is a really big state. I came from a state where I was running a health center for a few years, like I said, in Vermont, where the total state population is just a little over 700,000. So here's a quick story. So exactly. So driving up to Vermont, either Route 91 or Route 89, to love to look at the signs. You would see, deer crossing. My all-time favorites were bear crossing, right? The moose crossing sign is the one that really kind of gave me shivers. But the best one ever was wildlife next 20 miles. Like whatever it is, it is. So just expect the unexpected. So in the great state of North Carolina, we have 42 community health centers, 1,400 individual organizations in the United States, 30 million patients. We serve as an aggregate 1 in 11 people across the United States. That's a lot of impact. That's a lot of impact for community health centers. And it made me think about this organization. It made me think about the service, the why you're here, to change lives, how there's so much synergy between what we do in healthcare, what we do in social services, and what you do in your communities, right? To actually make it better, right? To fix problems, right? Not just to come together. I see we got a really energetic corner back there. That seems to be the hot table, right? But at the end of the day, it's more than just the senior club, right? Mm-hmm. Right?
Come on.
It's a group. It's a group of professionals. It's a group of residents that have come together and somehow weave the thread and the fabric together to actually make an impact, a measurable impact across Wake County, especially in Cary. Next slide. So what is Advanced Community Health? Since 1972, we've been serving our community at large. You can keep looking up. So we serve the private insured, the uninsured, the underinsured, and the underserved. The big thing that a lot of people don't know is that we have nearly $5 million in uncompensated care that we provide a year. A little health center like us, $5 million in uncompensated care. That doesn't mean that we do it cheaper. That doesn't mean that we skimp on prescriptions. That doesn't mean that you get a medical student versus a real fully fledged doctor, right? We provide that because that is what we're on the hook. We made a decision almost 50 years ago as a community to take a grant and leverage that grant nearly 6 to 7 times over a year to nearly a $25 million operating budget to serve our communities and to expand to 7 locations now. So Advanced Community Health, 49 years of a HRSA grant. So a quick history lesson for you is that back in the 1960s, when there's so much talk about social justice now, community health centers were built on social justice. The movement, the original movement, right? Making sure that whether it was New York, Chicago, LA, right? Rural parts of North Carolina, the deepest rural parts of South Carolina, right? That we were going to make sure that we ensured access to healthcare. Housing, healthcare, education, it goes hand in hand, right? So that little HRSA grant that we got back then was called Neighborhood Health Grants through the feds, launched our first site, Tarboro Road, okay? Then from there, we continue to offer first-class services, high-quality care to our communities that we serve every day, a high level of primary care. Every patient, every time, in response to the communities that we serve. And that's our mission. 49 years, you can hit it again. 49 years and one more time. We didn't get a chance to practice that, but anyway. 49 years of starting with one location, one small grant. So 7 years after, we'll be celebrating our 50th year anniversary next year. 7 years after the first neighborhood health centers were built in Mississippi, in Dorchester, Massachusetts, okay? Raleigh had its first community health center. Wake County had its first community health center. And 49 years later, we have 7 locations serving thousands and thousands of patients every year. Next slide. So we're a one-stop shop. It sounds good, it sounds cool, but really what does that mean? That means that we are multidisciplinary. We are no different than any other large primary care practice. The only thing that makes us different, I think better, is that we don't have to turn people away. If there's a mother or children, undocumented, documented, underinsured, just lost their job, it doesn't matter, right? We have to serve them, and we will serve them with the same high quality care that you would get anywhere else, right? So internally, we have family medicine and internal medicine, dentistry, family dentistry. We have a behavioral health and wellness center, okay? And we also have our pharmacy, which I really don't like discount pharmacy, but it's a pharmacy. It's a full-fledged pharmacy. The thing that makes it a discount pharmacy, we have this really cool deal with the feds, right? That we can actually buy our drugs, right? Wholesale, deeper than wholesale. So whether you're an uninsured patient, a commercially insured patient, okay, or someone off the street, you benefit by being a patient of Advance because we kick those savings back to you. That's a pretty good deal, isn't it? That's a really good deal. So I worked at health centers before and actually health centers where I looked at rooms just like this. Let's take Stowe, Vermont, right? The land of third homes, where people actually have that much money where they want to build homes in the snow to ski, right? We were their provider of choice. They chose to come to us because not only did we have great physicians and great providers, they benefited. They benefited. Their benefits, where they were in their life, we were saving people $1,300 to $1,500 a year. We were accessible, but on their prescription costs. So we're more than just a little engine that could. We're more than just a free clinic, right? The free clinic days are long gone. We still follow our mission, but we are positioning ourselves and repositioning ourselves to actually be more competitive and have deeper penetration into all communities that we serve. Next slide, please. So I just wanted to highlight our pediatric behavioral health. These are some of the things that people don't know. We have a full-fledged behavioral health and behavioral health and wellness center at Advance that is growing leaps and bounds. So right now we have an integrated system of care where it's team-based. Our pediatricians, our internal medicine providers and the like, they actually share patients. So as people pop up for positive screenings for depression and whatever else, our LCSWs and our therapists are there to take care of it. We're actually starting to turn that a little bit to actually be more forward-facing in the community. So now we can have more access into the community to actually be a site for health and wellness. So if you need a therapist, right, and you don't have one, but you already have a family doc, it doesn't matter. You can still be our patient on the behavioral health and wellness side, right? Private, confidential. We're expanding that health and wellness component, especially with the adolescent ages, to start to deal with medically assisted treatment, Suboxone. You know, when you start talking about the heroin epidemic that has ravaged through a lot of communities. I grew up in the inner city. I grew up in Camden, New Jersey. I don't know if any of you know anything about New Jersey or Camden, right? For years, the whole time I grew up in Camden, it was the most dangerous and the poorest city in America, okay? So I grew up in the crack epidemic, and I saw what it did to the urban centers, right? It wasn't until it hit home, right? Into better communities where we said, this is a problem. This is a public health epidemic here, doc. That's what people started saying. So we're positioning ourselves now to be actually forward-facing, not just for the mental health capacity, but to also be forward-facing for those services that our entire county needs, right? For those support services. Next slide. Insurance enrollment assistance. North Carolina has just entered into Medicaid transformation. Really what that Medicaid transformation is the shifting of people that are currently on straight state Medicaid into programs and products that they're going to choose, right? 5 different payers have entered the market. So we are actively navigating those individuals into the best product for them. People have a choice, people that don't actually choose, we hope that they choose us. But we have put a lot of resources and money into ensuring that we have a diverse group of enrollment activities and individuals that are actually performing these activities to help people navigate through that system. Because guess what? If you don't know healthcare, if you don't know what insurance to pay, if you ever needed to go through a state system, you know how convoluted that could be, right? It is very, very tricky. So we are actively involved in our communities to actually get people signed up into the right programs and products. COVID-19 testing, vaccination, and mobile health clinic. Has anybody heard of the COVID-19 pandemic? I thought you were all hibernating for the past 16 months. Everybody just came out for barbecue chicken today. But at the end of the day, this is where we were on the front lines as a community health center. We've actually started to shift our resources now to become more walk-up and more walk-up accessible. Over the past few weeks, we're actually taking that vaccine show on the road. We've done interactions with the YMCA South Raleigh, the Mexican Council, several churches, several other community groups, right? But our impact with that over time, I just want to read some of these numbers to you. 321 testing events, just the testing events, since the pandemic first started. That's over 30,000 tests administered in the past 15 or 16 months. Nearly 8,000 vaccines administered. And we remain in the top 10 consistently from the State Department of Health, our health center, for having the highest penetration of those that would not actually be offered the vaccine. That's the health equity conversation. So we are in the top 10 consistently with ensuring that our numbers are some of the highest with reaching those communities that are impoverished, communities of color. That's meeting the mission, right? And impoverished is the key. Impoverished is the key. Impoverishment really doesn't have a face, right? It doesn't have a face to it, right? It's how people live. It's their lack of something. We're trying to meet them where they are to provide for them the avenues to actually learn more, to have the self-efficacy to change their lives. And we're doing that with healthcare delivery. We're just really trying to figure out what their needs are. Our community engagement continues to grow. So even though this slide shows a lot of happy stuff during and pre-pandemic, the community engagement piece to me is really about advocacy, right? Lobbying, advocacy, changing policy, right? How do we make healthcare more affordable? How do we make healthcare more accessible, right? How do we make healthcare more equitable? These are national and worldwide questions. The United States is still trying to get it right. I'm not saying we're all wrong, but we're still trying to get it right, okay? There are folks in this room right now, right, that have pretty good health insurance, that you have problems with your health insurance, right? You got pretty good health insurance and you got problems with your health insurance. You don't like everything about it. Think about people that have no health insurance or have to be forced into a product, right? Because they're trying to get their life back on track. Think about the things they may not like about that. So for us, it's about the partnerships. How do we leverage who we are? I mentioned earlier on in the conversation, we have this federal reimbursement model that pays us more for Medicaid visits. For the worst patients, for the most complex patients, right? So we get paid a little bit more because we have to do all these other things that we don't get paid for. Nutrition counseling, right? Social determinant screening, right? a lot of social services and case management to get people to where they are, right? 80% of bad health is not about I ate something bad or I don't exercise. It's about my environment, right? There was a big experiment years ago, a big project in Camden about how do we change the worst of the worst, right? So they started geomapping the highest rates of EDUs in the inner city. And what they found out is that you had some of the highest rates, right? Where you had public housing, where people were having 1,300 per thousand, right? 1,300 per thousand ED rates. That means everybody got one plus some, right? People were misusing the healthcare system. This is why costs are so high, right? But my point here is that if we could leverage the FQHC banner and the payment mechanism as a partnership, right? Think about how we would lessen the burden on our county, right? So this is what he mentioned about a disruptor, right? I like to start trouble, but I like to start trouble by people thinking, okay? If we have a federally designated health center in this county that serves Wake County and Franklin County, right? If we're all taxpayers in this room, right? We pay county taxes, yes? I'm new to the South, but we pay county taxes, yes, okay? Who's not paying their taxes? But seriously, if we have a mechanism in place, right? That we've been deemed almost 50 years ago to say, you're the best payment mechanism and the best price at the pump for healthcare, not just for people that are on Medicaid or people that are underserved, but really for everybody. Why wouldn't we leverage our partnerships, let's say with the county, for that to be the throughput for all patients like that? I could go to any primary care practice now and would say, the rates are killing me. I can only take with so many Medicaid patients, right? I can only take with so many self-pay patients, right? But at Advance, I already told you, we're giving away $5 million of free care a year, right? That's what we do. That's what we're supposed to do. So my push for you today, as we talk about increased partnerships and maybe board participation, is help me as I'm new here to understand how to navigate that value-based conversation. How do we disrupt some of the norms and create more partnerships, okay? So the plea here is not for you just to join our board, but reach out to us. You can reach out to Kelly, you can reach directly to me. I don't even know my office number yet. I've been there just a short few days and weeks, but I have some cards here. We're actually looking for new board members. We're looking for active board members that can do three things for us. I'm sure you've heard this before. Time, talent, and treasure, right? Time, talent, and treasure. You can't be dedicated to give us one of the three. Don't call me. Don't call me. But you can call for coffee or lunch or dinner, and we can talk about how do we transform healthcare? How do you, as Rotarians, learn more about advanced health? How can you help carry the banner for us like I want to help carry the banner for you? That's all I have for today. Thanks so much, Doc, for inviting me. This has been great. The food was excellent, and I love the jokes. Appreciate your time. Is there time for any questions?
Yeah.
Definitely. Yes, ma'am.
If there's a particular area that we know about that can use your services, how do we let you know? I'm thinking the van would be a perfect place.
Okay, so I can actually give you my card. Kelly's here, she can actually give you her card. You can get directly in touch with me via email, and I will make sure that we get all the details to actually get out to that community. Yes, sir, and then.
Can you tell us a little bit about your budget and where do you get your funding from?
Sure, so our budget is basically seeded every year by the federal government. So HRSA is who funds us. It's the Health Resources Service Administration. So it's out of DHHS from the federal government. The funds that come into HRSA come directly from, they don't pass through the state, they come directly to us as a health center. So every year our budget is fueled by about $4.5 million, a little close to $4.5 million in change in a federal grant. And when we sign on to take that grant, we have all these strings attached to it. And the main string attached to it is that you have to have high quality. You have to have your offices open a certain amount of time. You must offer certain services, right? Required primary care services, family medicine, pediatrics, internal medicine, senior health, dental, on and on and on. We've added additional services like behavioral health. We do some other cool things around our pharmacy, as I mentioned. But we leverage that every year to run an organization to the tune of about $25 million a year. So we work. So we only eat what we kill, right? Our doctors work hard, our providers work hard, and we're looking to actually expand that. We're actually looking to get deeper market penetration to actually offer these services to more folks. Yes, sir.
Two questions. One is, how successful are you making referrals to specialists? Second one is telemedicine. How's that being accomplished? What your stance on that?
So I'll take the latter first. So telemedicine is something that we really leveraged the past year and change because of the pandemic. You know, so we had the technology in-house. We weren't really using it because we like to get face-to-face with patients. We are now on a push to offer a full telemedicine line and throughput, okay? Where as long as that call is generated, either from your home or from one of our sites, we are golden. So we have had at least probably 10% of our provider enterprise utilize telemedicine over the COVID pandemic. We're just starting to pull doctors back off that schedule so we can refine what we offer. But all of our services at some point in the near future will be offered through telemedicine, even dentistry, believe it or not, even dentistry. So if you come, yeah, I'll be doing your cleanings. I'll be doing the cleanings. No, I'm joking. Yeah, but believe it or not, you can actually have telehealth dental. I've seen it done. It's really, really remarkable. So, and the first part of that question was around, hold on.
The ability to refer people.
So referral specialists. So we have some unique agreements with a group called Project Access. Project Access is a cohort of specialists that actually volunteer their time and services to Advance and other providers. So we don't necessarily have one-off relationships with, let's say, an orthopedic practice or even an endo practice or a podiatry practice. We have distinct relationships where we have hundreds of specialists across the county and across North Carolina that are donating services for our patients, for our underserved patients. We're looking to tweak that to now have more personalized relationships and agreements with hospitals and the like. But we have direct referral relationships with these specialists, so there's no accessibility challenges for our patients.
Scott, there's a question. Our group online, Rod Brooks, is wondering, notes that some healthcare systems have recognized that hunger and poor nutrition are root causes of health issues. Do you all have any programs or perspectives on this to help address hunger?
Yeah, so what he's speaking about is what I mentioned about the social determinants, right? So I can't really concentrate on my diabetes care if I live in a food desert, if I don't have access to really good food, or I don't really understand my nutritional needs. So we have in-house case workers and case managers, but we have a full cadre of nutritionists that actually are part of our care team. So these individuals actually are part of that care planning for individuals. So even internally, we're working actively to figure out what patients need, what their families need through our screening process. And just not to say this is where you need to go. We're actually going to get you on a nutrition regimen in-house. But externally, we have bolstered our relationships with the food bank and food pantries, where we're actively starting to bring back in now, post-pandemic or in the tail end of the pandemic, fresh fruits, vegetables, cooking classes, and the like, to actually educate our community on how to eat better and how to solve some of their challenges and barriers around food and nutrition. Anyone else? Yep.
Do you not have state funding?
So there is minimal state funding. We do, partner for some grants, but we are a fully federally funded agency. So, again, all our money is coming through a non-tax way. We have really high impact in who we hire, how our dollar kind of turns around in the community. We can speak to that social impact and community impact to say who we've hired in certain communities, how that spans out across certain management spectrums in our organization. But there's a high degree of impact that we have with FQHCs. And again, to be a disruptor, I'm trying to jump on that bandwagon and have people carry the banner of this is the place where we need to leverage care for the indigent, for the underserved, right? These individuals shouldn't be going to our hospitals and in the ED, right? Because the hospital funding that offsets uninsured is coming out of whose pockets? Taxpayers, right? That's who's funding that.
Real quick, referrals.
Yep.
Where do you get most of your referrals? Because a lot of people, and quite frankly, I wasn't totally aware of what you all did. But to get your patients, do you get referrals from where?
So our referrals come from our partners. So we have a healthcare from the homeless site. So we get a lot of referrals from transitional social service providers. We get tons of referrals from the county, from their social services department, and just word of mouth. 50 years in the business, you start to see generational families come through. We provided care for the grandmother, or still provide care for the grandparents and the parents, now the grandkids, and maybe the great grandkids.
That was a darn good question, wasn't it?
That was a good one,
That was a
man.
great question.
He's a piece of work.
Scott?
So you have a location at Dorcas Park?
Yes, yep, we do.
That's where you are.
Yep. We are at Dorcas, but I really like that location. And I will tell you that I like to see that location grow. I like to see that location look a little different. So here's the interesting piece about us, right? And here's the plug for us as an organization. Again, like the whole presentation wasn't, right? We have to mirror the changes that are happening across our communities, okay? So like I said, we changed our branding, and culturally we're shifting our agenda, but we're still the same, okay? But I don't want anybody to leave here saying, that's just a free clinic, because it ain't, we aren't, right? It ain't a free clinic, okay? It's multidisciplinary healthcare that just so happens, right? Without a bat of an eye, we take care of folks that are uninsured. It wouldn't have anywhere else to go. So there's a lot of physical changes, there's a lot of optical changes that we're doing to actually make ourselves look different, right? But the care is first class. So yeah, we're at Dorcas Plaza. I love that location. I think it's really, really cool. We're looking to actually expand ourselves into bringing a pharmacy out to Cary.
What do you think about Howard?
Oh, Howard's he's a good guy.
He should be on.
He's a good guy. Is he up there, Howard?
He typically is.
Yeah.
Okay.
That's what I.
Yes.
It's a tremendous thing. If our goal is to address inequity in access to healthcare, you talked about accessibility, proximity, engagement, care delivery. What's, as citizens, what's our best leverage point to try to close that gap?
The best leverage point is, how do we rally around a certain cohort of inequity? Meaning, where do we see inequities birth? Where do we see them bred and fed and then foster themselves to become bigger costs, bigger challenges? It's the kids. It's the kids, right? So for FQHCs, you think about the bread and butter is pediatrics, right? Mom and kids. But for us as a community, you start thinking dental care, pediatric wellness visits. How do you start to embrace communities, right, that feel disenfranchised, that just aren't educated enough, right, to know how to navigate, to know when they need to enter, right? So you think about the cost of this. I always look at it like this. A cost of a family, the true cost of that family. That's not healthcare, but whole health, right? So you have a family that's on social assistance, social service, right? You have a kid that's on free lunch, right? Okay. You have maybe a mom or a father in or out of the home that also has a caseworker coming by to make sure they're doing the right thing for kids, right? Maybe someone's on probation, maybe someone's on parole, right? So there we've hit on what? 3 or 4 systematic impacts of health, right? And all the time we're sharing in this family's inequity, right? We're sharing in the inequity of how do we get them to a more stabilized place of whole health, right? Emotionally, spiritually, and physically. So if you were to ask me about where do we meet them as a community, I would say, as Rotarians and as an organization, we have to get to the kids. We got to get to the kids. We got to get into the schools. We have to make sure that it's just not a footnote. We did something for kids that we can actually measure, right? How many kids did we get screened for dental caries? How often do we have our mobile health van doing dental stuff and hygiene at the schools, right? And not the schools that are pretty well. I'm talking about the schools where 100% of the kids here get free lunch. Like we know, right? The kids where hey, this school district went 100% remote and 75% of the students here don't have access to internet. That's where we need to be. Any other questions? We're good?
I would like to say thank you,
Oh,
Scott,
thank you.
for coming today. And since you're new to town, we'll give you pictures of historic
Oh, that
things
is
in Cary done by Register Office Jerry
Thank you
Miller.
very much.
And
Thank you very much.
Kelly, for you also.
Oh, wow, thank you.
And thanks
Thanks a lot, everyone.
Thank you.
All right, so next week, David Coulter will be hosting, and Amanda Bunch will be here. And she'll be updating us on a variety of topics involving the town of Apex. So we look forward to that. That'll be exciting. In 2 weeks, Dr. Bruce Howe is going to be hosting Dale Falwell. Always a pleasure. Bruce, we look forward to that. Now, I don't know if anybody noticed. Again, my bad. It wasn't cheeseburgers this week. I'm assuming y'all figured that out. Cheeseburgers next week. I missed the line. It happens. Anyway. No, you got to pay more. Cheeseburgers next week, fries, and whatever else you want to put on. So today concludes just an outstanding meeting. I'd like to thank Charlie for hosting today. Thank you. Well done, Scott. Fantastic. Kelly, glad you were here. You kept Scott in line. That's very important. We need to make sure that happens in all instances. But seriously, great presentation. A lot of great information. So would like to once again thank one of our visiting Rotarians. Always a pleasure.
It's always a thrill.
But you're no longer a visiting Rotarian. Actually, part of our club structure is such that if you attend 2 consecutive meetings as a visiting Rotarian, you automatically become a member. So congratulations, our newest member. So anyway, I would like to ask.
Can we vote on that?
Yes, we. I'd like to ask Don Finkbon to lead us out in our 4-way test. Don?
Of the things we think, say, or do first.
Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned?
Meeting's concluded. Have a fantastic week, everybody.